I know a lot of you guys know me as clients. Got a new person that maybe not everyone's met, Pat Ford, with us. He's with our team now at Security First. Shana Fossum's here with us. She's our video crew tonight. And then we have someone new to introduce to you, Emmy Intapa over here. She'll be tag teaming and helping me out with the presentation tonight. Emmy she's been in the Medicare arena for a good many years. I just gave my phone away to
no
have
worries.
Your introduction.
Yeah.
So why don't you tell us a little bit about yourself, Emmy?
So I've been in the Medicare world since 2009. I was in the consulting business before then, but I love Medicare because I like to be able to help people who are so confused by it. It looks very complicated and it is difficult. So I enjoy one-on-one meeting with people and helping you guys understand it. We're going to try and simplify it the best we can, and then we'll address any other questions that you guys have from there. But I'm excited to be here and be a part. So thank you.
We first met Emmy as a client.
Yes.
And then this past year, she was talking with Daniel and talked about, her business background, and we decided we could make a partnership together. She lives in the Macon area. I'm mostly in the Dublin area, so it makes a little more sense. She can help out up here easier than I can a lot of times. And I've got finally someone to talk shop with about Medicare because
that wants to talk shop.
Yeah, we can speak the same language.
Yes, we talk the same language.
Yeah.
Yes.
Most of the time I just get questions about it. Now I can get answers.
Yes.
So no, I'm excited about that to have Emmy partnering with Security First as well along those lines. So we'll get started. I'm going to keep this one pretty low key and relaxed. A lot of question and answer is kind of what we're expecting. I've had a PowerPoint in the past and they can get a little boring, but we got these great handouts and we're going to just basically kind of go through it. And we've got some notes you can make on the pad or on the handout here, because those are yours to keep. And we're just going to kind of walk through that as we get questions in the sections. We can address those at that time, or if you certainly have questions at the end, we can do that.
Can I say something real quick?
Sure.
These are United Healthcare, but we represent more than United Healthcare. We do not represent every company in the county, because there's tons. Mm-hmm. And if you want to know more about those in your Medicare and Me book, you can see everybody. But we do represent a lot of the major ones. We just used United tonight because it's got simplified information. It's generic, it's general, other than you see the United logo, but we're not promoting, we're not suggesting, we're sharing their literature, but we can help you review all plans.
That's a great point. Yeah, they're the ones that put out this literature, but it's general educational literature. Is it? You got someone else?
Yes, good morning. Come sit back there.
All right. So we'll get started then. Does anybody have any questions before we get started? I'm sure we'll probably address some of your questions maybe as we go along, and certainly we can expound on those. Everybody's situation is a little different, so we'll hit on a lot of things here. And again, Emmy and I will just kind of tag team this and be able to answer any questions. And certainly we're going to be around afterwards a little bit as well if you have a specific question that you don't want to ask in front of the group. Okay? So we'll just kind of walk through it page by page here. What is Medicare? This federal program that offers health insurance to American citizens and other eligible individuals through programs Original Medicare Part A and Part B. So U.S. citizens, legal residents, must be in the U.S. for at least 5 years in a row, including 5 years just before applying for Medicare for most folks. Age 65 or older generally. There's some other people younger than 65 with qualifying disabilities, and any age with a diagnosis of ALS or end-stage renal disease. So if you get in those situations, they automatically give you Medicare quickly. So what does it cover? I've titled my message in the previous years the A, B, C's, and D's of Medicare, because there's so many, it's like the alphabet soup there. A and B, well, first of all, on this next page, Part A covers inpatient hospital and skilled nursing care. So that's one, the one you hope to not use, but it can lead to cover some of the most expensive stuff. Part B is probably what people use more often. It covers doctor's visits and outpatient care. So that's just a general compartmentalized A versus B. A is, you've gotten that generally, free through paying in while you worked. B does cost money for most everyone once you do go on A and B. That number is going up to
Part B is $240. That's a big jump.
Oh, the Part B, that's a
excuse me.
deductible, that's a deductible.
You're right, I'm thinking the
Yeah.
I was looking
Yeah.
at that on the way over thinking,
The-
oh my God.
Right, the Part B premium
I'm sorry.
is $164.90 right now for most people, and it's going up to $174.70 next year. Amy, do you have the $174.70?
Yeah, 174.7.
Yeah, so the, if you make, that's for most people, if you have higher income, that number can be higher, so they expect you to pay more because you make more. At the, let's see, greater than, what's that joint, on joint, greater than $206,000 joint annual income, you gotta pay $244, and then it jumps up in increments all the way up to $594. And I've had that come up with some people, even if it was some kind of major windfall you had, maybe just, sold a piece of commercial property, all kinds of things that can trigger to jump you up into that, even though you don't make that on a regular basis. But it's usually a 2-year look that they do.
Yes, it is. I just had somebody, a very good friend of mine, fall into that last year. They sold a very big piece of property and they didn't buy quickly. And so that was their income for that year. And so the two of them are stuck with that $500 and some a month for 2 years.
For 2 years. So eventually it'll catch up and they'll look at, what's your current income, but they'll usually sock it to you quicker than they'll stop it. So that's the Part B that you actually pay for. That generally comes out of your Social Security check. If you're not drawing Social Security but are on Medicare, they will bill you for it, usually 3 months in advance. You can set up a monthly draft for that too. I've got some folks like that too that are going on Medicare but they're still working, so they aren't drawing Social Security yet, and they have to pay them directly. So then you can choose to get more coverage, and that's what we're going to kind of go through, compartmentalize those. Prescription drug plans are Part D. That's really the only one that makes sense from the alphabet. Part D for drug plan. You can buy those as a standalone plan, or they do come a lot of times in a Medicare Advantage plan as part of it. You can then get a Medicare supplement insurance plan or a Medigap plan. Those have been around a long time, way before these Medicare Advantages have been around. They're very consistent on what they pay. They're very easy to use. You don't have to be a part of networks, things like that. But they do get more expensive, especially as you get older. They go up. But the coverage is very consistent, very good, and you don't necessarily have to change plans, every year or two. So generally, if you have a Medicare supplement, if you choose to go that route, that fills in the gaps that A and B leaves behind. Any Part A deductibles for hospitalization will be taken care of through a supplement. Part B, the best plan you can purchase now is a Plan G, another letter of the alphabet, but it pretty much covers everything Medicare leaves behind except for the small Part B deductible, which
It's now $240.
going up to $240 a year. So Plan G is the best one you can get. They used to offer Plan F. They stopped offering that in 2020 for if you already were eligible for Medicare before 2020, you could still get it, but since 2020 you can't get that. Okay, so then a lot of what people are hearing about is Medicare Advantage plan or Part C. Not many people think about it as Part C, but again, staying with the alphabet. That is basically a private company administering your Part A and Part B. That's why you see the commercials for Humana, for United Healthcare, Aetna. Those are the major ones. Clover is one that's been kind of up and coming in the area here. And some of the crazy commercials that you see. I haven't seen Joe Namath yet this year, or Jimmy J.J. Walker telling me to call in and get what I deserve. But I have seen some new ones that are, I don't know if they're any better than those. It looks like they've gone away from maybe the spokespeople,
Yeah.
the
Celebrities.
the celebrities, and then maybe they're going to, trying to create new
Still want
celebrities.
you to call in though.
That's right, that's right. So, but the Part C Medicare Advantage, that's where things get really confusing. There's a lot of options. It's based on zip code. At least they finally started saying that. It was, one time they didn't have to even say that, and it's just call this 800 number and get what you deserve, you know, and they tell you this laundry list that sounded like the best thing ever. And then all of a sudden, oh, well, they ask you a few questions when you call, and oh, you don't qualify for that. Oh, that's not in your zip code. Hey, but while I got you here, why don't we sign up for this?
That's exactly what it is.
Yeah.
Or you don't have Medicaid,
Yeah, yeah,
and those are all the benefits if you have Medicaid.
exactly.
And you make you feel like everybody can have that.
That's right. So there's, you know, obviously most people realize that there's a hook in that bait if you call in. So, but they do the Medicare Advantage plans. This is an area I think they've gotten better at. They do offer additional benefits that Medicare doesn't offer, with dental benefits, hearing, vision,
Transportation,
yeah,
food,
transportation,
if you come out of a hospital,
mhm.
purse, the necklaces, personal response systems come with some of them.
Silver sneakers,
Yeah.
gym memberships. So they do, they've really gotten creative in trying to offer those additional benefits. So, you know, they're very, they offer more of them in other areas than they used to. I met with someone recently that lived in Florida that moved to Georgia, and they were in an area that, you know, was heavy with senior retirees, and the benefits that they had been used to versus what they have available to them now were totally different. The maximum out of pocket was much higher.
Yes,
They were getting like a full give back of Part B, and the best they could do here was like $100. So they were, but it was because of the concentration of people that they could draw from in the area they moved from. They had more creative ideas down there. So, but those are the main differences right there. What you can basically, A and B you'll get automatically, but you can choose to add to it through a supplement in a drug plan or through a private company administering Medicare, like a Part C Advantage plan. Next page kind of shows the multiple options there. You can just stick with Part A and Part B. For the most part, that's not a great strategy. It is gonna leave some out-of-pocket costs behind. To me, if you're just gonna stick with Part A and Part B, you probably should get a Medicare Advantage plan. For one, there's a maximum out-of-pocket.
right, there's
With-
no ceiling
Mhm.
with a original Medicare.
Right, with that A and B only, you can get 20% until there's no end in sight on that. So all those Part B expenses especially, or if you go in the hospital potentially multiple times during a year, you could have even more than one deductible to meet. So that's page 4, if you're following along there. I keep kind of jumping around a little, but so A, you can have A plus B plus D, which is the drug plan again. There's also, can you explain the penalty for the drug plan if you choose not to get it?
Yes, so in that thick book that you get when you become eligible, it does say in there that you have 60 days to purchase a prescription plan if you're on Medicare. So if you do not, you can occur a penalty, and you will, unless so the penalty is like 1% of the national average of the drug plan, so it's 3 cents a month, but that adds up. I've come across people in their 80s who've never had a prescription plan because they did not know. They did not read their big book, and I get it. So when you do get a prescription plan, they will penalize you every single month from then on. It doesn't go away unless you have low income subsidy, which is another thing you could qualify for. If you make under, that number's like $1,800 right now. If you make under that a month, you can get help with your medicines, and then you would not be penalized for your prescription plan. But you do want to get that within 60 days so that you will not get penalized.
Is the other option though, if you're still
Have
getting
credible
employed?
coverage.
Yes.
If you have
Yeah,
credible coverage
that's
through
right.
your employer,
Yeah.
you don't have to take out B or a prescription plan. You can delay it with
That's
no
right.
penalty.
That's right.
But Part B as well, if you don't take it out when you're due it, and you don't have insurance, which you won't, because insurance companies won't insure you if you're Medicare eligible, because you're supposed to get Part B. So you can get penalized for not getting Part B if you don't have credible coverage.
Yeah, that's a good point. The caveat to most of those rules, if you're still employed and under your employer plan, then you got credible coverage, and when you go off of that, eventually, you can get in these with no penalties. So yeah, that drug plan penalty can add up. I've seen some people like that too. And even people that come to me and say, I don't take any medications right now, why should I get one? But that's the reason, I don't wanna pay the penalty. This year, in fact, or 2024, there's one drug plan like for 50 cents.
That's right.
So why would you not get it, even if you didn't
That's
take
right.
any medication, so.
Might not be there next year, but it's there this year.
I know,
Or, I mean,
exactly.
2024 it's there.
I
Just
was
kidding.
surprised to see that. That was like an $11 plan last year, or this current year, and it's going down to 50 cents.
Is that
It's
in
almost too good to
Georgia?
be true.
Yes.
Is that one
Yes.
in Georgia still?
Yes.
It is,
Yes.
yeah.
I mean, does it still have great coverage?
Yes,
So far, what I've
Yes.
looked at, it's
So,
gonna be
yeah.
coverage.
Sometimes you get what you pay for, is what I was asking.
Well,
That
that's the
isn't always.
catch, you think that, that's not always the case here, because there are some plans that are $100 a month, and it doesn't, between.
no, and that's why
premium-
you should see somebody about your plan, so your medicines are compared. They're looking at your cost, and we
Right.
would run that through your doctors and your medicines to make sure whatever plan you choose is a good one for a good fit.
That's right, so keep going down here, you could choose to get Part A, Part B, plus a Medigap, or Medicare supplement coverage that would fill in the gaps that A and B left behind. Really, if you're gonna do that, you definitely need to get a Part D drug plan to go along with that, so that's really the full coverage. If you go the supplement route, you need A, B, Medigap supplement, and a Part D plan, to have full coverage on all sides there. The Medigap too, just to kind of think about how it works differently than the Advantage plans. If you have the Medigap policy, provider bills Medicare first, and then whatever's left over, they turn around and bill your Medigap plan, and it pays. So it's a little more complicated. It's not just one card, but again, the coverage is excellent, but you do pay premium, and will probably go up over time.
It does, like 4 to some 10%, and you can do research, and we do. We see different things, but they do go up every year to some extent. There has been a moment or two when a company did not increase, sometimes. It just depends on the statistics.
That's right. And they can't single you out and only increase yours. It's across the board for everybody with that
Is
particular
it
plan.
across the board for across the country, or is it done
No.
by state, or?
But they'll single out states to do, or sections of states, I think even, depending on how
It
many
makes a
people.
difference what state you're in and how
That's
much.
right.
It does,
Yeah,
they vary.
for sure. Yeah, it's a wide range, but probably, I'd say 5 to 8% on average, just
Yeah.
go up, depending on,
I've seen them as low as 3 and 4.
yeah,
We tried.
Yeah,
Stick with
yeah.
those companies, just telling you.
That's right.
Yeah, so,
Mhm. So that's one way to go, A, B, supplement, and Medicare, drug plan. The other page, on page 5 there, gives you the Medicare Advantage plan. Again, that's what I said is a private insurance company taking care of your Medicare A and B, and they can also offer additional services that Medicare doesn't cover. So most of these plans do have drug coverage, but you can buy them without drug coverage. Give us some good examples of who might be
a
interested in
great,
that.
for instance, you're 80 and you've never had a prescription plan, and you don't want that penalty. So we're gonna say, maybe we should you've been doing fine, cause maybe you're not on medicines, or you're using a good RX or single care or another card. So you don't need a plan that has that wrapped in it. So you can get a MA only plan and not be penalized every single month with that bill. You could be TRICARE. You could have a prescription plan, a great company that has a prescription plan, but you want the extra benefits, like the dental, vision, and all that is entailed there. There's a lot of good benefits with Advantage. So you wouldn't need another prescription plan. You can get an MA only. You might be a veteran who gets his prescriptions every day. So you would use a MA plan. And that way you're not getting in trouble for not having a prescription plan. You just already have one.
That's a good point on the avoiding the penalty for prescription.
Yes.
Because until you sign up,
It's a beautiful thing.
it's
It does
still,
work.
it's still calculating, but you don't have to pay it until
That's
you sign
right.
up for one.
It
So,
does not, mhm.
That's interesting.
And it's legit.
Alright.
You can do that.
Yeah.
In a comparison between, C and the, getting the Medigap, that you're talking about, George, is there a big
Pricing?
difference more, is, the advantages and so forth?
So there's a lot of, there's a lot of Advantage plans that run zero. Some of them have premiums. If you wanna bring down that maximum out of pocket, you can have a small premium, $32 or something like that. But they include everything, so you're not paying extra for your prescription plan, you're not paying extra for your dental or your vision, it's all wrapped up in there. A supplement, a good round number just that's safe, cause they vary. And we would shop for you and look at your options, and if some people are brand friendly, I want this, whatever, you know, according to what fits your needs. But, around 150 is about the rate, it's a safe number, and it's not an exact quote for about a 65-year-old. As you get older, it might be a little more, it could be a little bit less than that, it depends. But that's including you're purchasing a prescription plan to go with it. So that's just a ballpark.
So, yeah, on page 4, you pay more per month for that coverage, but you're not gonna pay very much out of your pocket when you use it. Over on the other side with the Advantage plans, you're not gonna pay very much per month, but you'll pay as you use it. You've got co-pays, you've got cost sharing for every service that you get, whether that be some sort of an outpatient procedure, a doctor's visit. You'll have some minimal co-pays for all those types of things. The biggest potential cost you have with that is a hospital stay. It's usually a per day hospital stay, maybe $275 to $350, depending on the plan.
Per day.
Per
For
day.
the first 5 to 7 days.
That's right, or
Is how that
maximum number of
works, yeah.
days. So pay less per month, pay more as you use it, or pay more per month, pay less as you use it, so.
And there's also a really good strategy that you can use too. I have people who are doctors who say, I want an Advantage plan, I wanna just pay my co-pays. I don't wanna pay monthly, whatever. And there's others who say the other, it's all in what's comfortable to you. But you can also get an Advantage plan with a zero premium and get a supplement, cash program, like it's just called a supplement, that will fill those gaps of what you would pay out of pocket if you're hospitalized. That's where your major expenses are, your first few days in the hospital. So sometimes we could pair that with a supplement that works with it, that runs $30 to $50. And it's a nice fit for you and you're comfortable with that copay. It's really what you wanna budget. Yes?
So you're saying that if you've got a Medigap
Yeah.
plan, that you can also get an Advantage plan? I
No,
thought you couldn't do
can
that.
only have one or the other.
Well, that's what I thought you
No,
just
what I
said.
just said, it's a supplement, so, how do I wanna word that? So it's a cash plan, it's not a Medicare
Like a cash in-
supplement.
Right, cash indemnity
Like,
plan.
almost like an Aflac plan, you
Mhm,
know
yeah,
that?
yeah.
You get hurt, you get
Mhm.
cash. So there's plans that are, called supplement plans, they're not Medicare supplements.
Oh.
But they're supplements, and they will supplement that hospital fee, so that if you're hospitalized, you get that cash
To pay the copay.
to pay that copay
largest
out of
copay,
pocket.
yeah.
So you've got your zero, almost paying nothing, to your middle of the road where we fill my holes and my gaps where I'm gonna pay, or you just wanna pay nothing when you go to the doctors and hospitals and not worry about it. Just show your card, and would be a good plan for you if you're that person.
Yeah, that is a good point. Yes, ma'am.
I have heard, and I don't know where, someone say if you go to an Advantage plan, you can't go back to the, Medigap and.
Supplement.
Yes, yeah, you can, but you have to qualify.
No, 1 year. You have
Oh,
1 year
oh,
look back.
1 year, 1 year.
The
Yeah,
1 year
yeah,
look
that's a good
back.
point, yeah.
And if it's an AARP plan, you have a 2-year look back. But the CMS has made it mandatory for a 1-year look back. So if you've been on a Medicare supplement and you go, you know what, I just hear so much about it, I wanna try it, you can try it. And within that year, if you're not happy and you wanna go back to not paying nothing when you go to the doctors and you want that premium back, you can do that.
Right.
And no health questions
But only
asked,
for the first year.
only for the first
And
year.
only one time.
Yes,
Mhm.
because
Yeah.
I always tell my people when they're thinking about what to do, You have 6 months when you're first eligible. 6 months, no matter when you're first eligible, to go with no health questions asked to pick a plan. You don't have health questions with an Advantage plan, but with a supplement, the first 6 months, you do not. If you say, I'm gonna wait, I'm gonna get an Advantage plan, and then 2 years later, you're diagnosed with something major, you might pay double, or you might not be qualified to get it. So those are things to think about.
That's right. That's a good question, for sure. Yeah, you have that one chance to try the other one and come back, within a year, so.
No health questions asked the first year.
And the problem with that, if you're on the Advantage plan, is if you get cancer or some major,
Advantage plan, you can have anything and still have it. It'll cover you. The Advantage plan. The Medicare Advantage, not the supplement. Well, supplement, if you're on it, they can't bump you off either. Once you're on it, and you're good. Doesn't matter what comes up later.
That's right.
but if you're gonna be in the hospital a whole lot, let's say you have the Advantage plan and you don't have the supplement, can you pick up the supplement after you get sick?
Depends on what that diagnosis is. If it's nothing real major, possibly yes, but it could be more expensive, or there's health questions you have to answer.
You have to
If you have
qualify.
something major, you do have to qualify.
You have to qualify and answer the health questions to go back to that supplement, except that one opportunity.
So might you be better to have this standard coverage with the Medigap and the Part D, just in case something's gonna happen in the future?
I don't know what you mean when you're saying that. You might, say that again?
The non-Advantage plan, would
The
you be
supplement.
better to be?
To get a supplement?
No,
If you have one, to keep it, is that what you're asking?
in case
I'll-
you get
yeah.
sick in the future.
I'll give you a prime example of that. My father, he's 10 years now being on Medicare. When he retired, we went through the same exercise, and he said, I'm in good health right now, but I wanna do the supplement. I wanna, I'll pay a little more, but I know I'm covered, no surprises. 2 years later, he had cancer. He had to go full-blown chemotherapy, the whole 9 yards. He had one of those F plans that covers everything. He never got a bill. He got statements. Here's what was paid, here's what was covered. If he had gone that route, if he went the Advantage route and then he got into that pickle, he couldn't have gone back to a supplement at that
That's
point,
right.
other than he couldn't have after that 6 months window had expired.
Right.
So that's an example of just what you said. Sometimes it depends on your situation. A lot of people think, well, I'm getting older, I'm probably gonna need health services more and more, so the supplement's definitely a consideration for a lot of people.
And there are a couple occasions, which is why it's always good to have a person to talk to. Say you moved from Florida and now you're living in Georgia. Well, now that you've moved to a new state, do you know you can get a supplement with no health questions asked?
That's a good.
I don't care how sick you are,
Yeah.
because it's an exception. So there are exceptions, and that's why it's
So
good
you
to have
get
someone
cancer
to
and then you
know.
move out of state.
I know. Sometimes
You've got another place
it might
to go.
behoove you.
Move there for a year.
So it is, it is a loophole. Or you're in a Medicare Advantage plan and it's going out of the area and they're not coming back next year. Now, you have another exception. You can make a plan change.
That's right.
So there are loopholes.
That's right. I had an example of that too, where a gentleman that actually had a diagnosis of terminal illness, he had an Advantage plan and he got a letter saying this Advantage plan is no longer gonna be in your area. And he had an open guaranteed issue enrollment for a supplement and we took advantage of it.
Yes,
So,
yes.
doesn't happen that often. A lot of times now they're mapping you to a new plan, but that particular case.
You mentioned the Plan F.
Mhm.
I don't know about a Plan F.
So F was the most popular plan a few years ago, and then G became more popular. The pricing, G only leaves behind $240 a year that you have to pay out of your pocket. F covered that also, but what was starting to happen, the premium for F was way more than $240 more on a given year. So G became more popular, and in 2020 they said you can't get an F even if you wanted it. So,
Unless you had Medicare before January 2020.
Right.
If you had A and B before January 2020, you could get an F plan if you want to, but when you
Right.
do the math, the G is really more economical.
Right.
So
Premium.
What is a G?
Everything, it covers everything in the hospital or the doctor's office, except for the, deductible at the beginning of the year, which will be $240 in
$240.
2024.
Let me say, there is one exception to that, because I have a G,
Okay.
and I had knee replacement surgery this summer, and didn't get any bills, you know, I haven't had a bill since I went on Medicare. And so I got a bill from the hospital, it was $362.50, and I thought, why is that? Why, you know? So I called them and they said, well, you know, it was denied by Medicare and by your supplement, and so you have to call them. So I called them and they said, oh, that's for A9270, self-administered drugs. And I said, I didn't give myself any drugs. And they said, well, that's what this is. So I called the hospital back and they said, well, these are the medications. It was my normal medications that they gave me. Now, they won't let you take your medications to the hospital, but they were giving me my daily meds. So they gave me my regular medications. It was called self-administered meds, and they would not cover it. So I called, I said, well, what do I do about it? They said, well, I would call your drug plans, because I do have a drug plan. So I called the drug plan. No, they said, it won't do you any good to call the drug plan. When I called the hospital, you know, my Medicare, Medigap company said, well, you have to deal with your drug Part D. So I called the hospital back and they said, well, they're probably not gonna talk to you, so we will refile to your Part D policy and see if they pay it. And so, another lady that I had spoken to at the hospital said, well, we normally only pay bill the patient for 10% of that. So I said, well, I'd be willing to pay $32, but I'm not paying $360 for 13 pills that I already had at the house. And I didn't pay that much for the
I
whole
have
3
never
months.
heard that. That
Right,
is,
I
that's
haven't
what it
either.
is. That
I
is,
just got billed $118.20.
Same thing.
For the same thing. They tell you, bring everything you take. Well, naturally, I took my allergy pills.
hey, they gotta make it back
I
somewhere.
took some Imodium just in case. It was all in the bag together. I asked for an itemized statement. They were billing me for an allergy pill I never took, and Imodium I never took.
Wow.
So they sent me a letter after they audited the account. The codes are right. I didn't question the codes. I didn't get the meds.
Right. Wow.
That is, I'm not
Yeah.
understanding when
So
you're
it
in
was
the
not
hospital.
resolved? You both had to pay?
I
I've
paid
never heard
mine.
anybody
Well,
But
I'm
I'm
waiting
not
to hear back
finished.
from it, because they
I
said they
would
you're
would
still-
refile.
you're
appeal
still in
that,
there.
I would appeal that,
Yeah,
I would
absolutely.
appeal that,
It
cause
says that
Yeah,
they
I'm
don't
not
pay
finished.
for
Good.
medications
You
that
shouldn't be.
are on your regular, that are your regularly prescribed medications.
RP says they already paid it.
Yeah,
Yeah.
so I don't know what they'll say, cause
Wow.
I just got them to refile about
first
a week
in
and
the
a half
last
ago.
14 years that I've been
Yeah.
doing this, that I've ever heard such a thing.
Yeah.
And I would fight that,
Well, I will, because I'll pay them the $36
Sure.
maybe if I
Oh,
have to.
but- And that-
but your hospital bill is part of that, they're supposed to,
Yeah.
that is.
Right.
Well, I don't understand, you know, because they normally tell you don't bring your drugs. Now, I didn't ask them,
Right.
and they didn't tell me,
Right.
but I just assumed you could not bring your own medicines, because they
Right.
used to tell you no, you
Right.
couldn't. Well,
Yes.
maybe I could have, but they didn't tell me that.
Times are changing, I
Yeah.
don't know.
So if you do go to the hospital, ask them if you can bring your own daily medications.
They'll tell you
Because you
no.
don't wanna pay, it was $75 for a pill.
Sure.
Well, then they wanted to give me an allergy pill I don't even take.
Yeah.
Because I don't have
And that was
mine.
just a billing error.
That's appalling, I've never,
I know.
wow.
Anyway.
That's
I'm not
interesting.
finished.
See, we're learning too.
Yeah, wow.
So
I'm not
Part
finished.
G
Definitely
doesn't
pursue that.
include
It does
your
not have
meds?
medication.
You have to have a
Well, you
Part
do
D.
need a Part D, yes, with a
Okay.
Medicare supplement, you do have
But
to get a
Part
Part.
G does not include Medicare.
No, a Medicare
Okay.
supplement,
Right,
which is
right.
the
Part
G
G.
or F,
I know, we've
Or
got too many
N.
letters
There's
going
an
on, I
N
know.
those do not include prescription, you will need to get one.
And the Part D plans that I have had experience with do not pay very well.
Well,
Oh,
have you ever
well.
had your meds put in and
Yeah,
calculated?
it's one particular very expensive medication.
Yeah.
If I buy it one time, I'm in the donut.
Yes.
Oh, wow,
For the
yeah.
rest of the year.
So in 2024, when you come out of the donut hole, you pay nothing. It's always been that you have a percentage that you pay, but in
I just quit taking that
2024, it's.
medicine for the rest of the year. I buy it one time, take it for 3 months, and then quit.
Yeah.
And buy it the next year.
Yeah,
Yeah,
it's
there are
really-
some very expensive ones that can get you in that specialty drugs and things like that.
Yeah.
It
The
doesn't-
majority is a lot of
Explain
diabetic
that
too, which is
donut hole.
sad,
And that's what this is.
and everything.
Okay. Let me see here. Does this go into the donut hole explanation?
I see it.
It does not. Okay, let's, that's probably a good place to talk about that while we're on the subject though. The donut hole, so all of the plans are built to be at least minimal coverage, and then they can build a plan that's better than minimal coverage, but there's initial coverage period, usually there's a deductible first, then there's an initial coverage period, and then there's a donut hole. I can't remember the numbers, 5,000?
5,000 to 8,000, I was just pulling up the exact, cause.
The deductible is probably gonna be around $505 or $545 next year for most plans. So if you take, especially an expensive tier 3 or above drug, you're gonna have to go through that deductible first. You have to pay the full portion until you get to the deductible. If you have a tier 1 or tier 2 drug, most plans, you don't have to worry about the deductible. They'll help you from day one. But you may have to meet a deductible, and then there's a period where you get flat co-pays or a really high percentage paid by the insurance company. But if your retail cost of medications reaches too much, $5,000.
It's $5,030.
$5,030 in retail costs, not what you paid, but what the total cost is, then you go into the donut hole. Once you're in the donut hole, you pay approximately 25% of that retail cost of the drugs until you go through that gap into catastrophic coverage. And as she said, this coming year, catastrophic coverage will cost you $0. So,
So
that-
that for one drug, I mean, like.
for all your drugs combined, all the cost of everything
Cost of
gets,
So
yeah,
when do
gets
you get
thrown in
the
there.
catastrophic?
It's, hold on, 8,000 and some.
8,000, I was
Yeah, I'm
thinking
getting-
7,000.
No, it's, in 2024, it's gonna be, 2024, it's 8,000, hold on.
Okay.
Say that again.
2024 is 8,000.
Yeah, it's gonna be over 8.
Change, yeah.
I think it's pretty close to that though, but,
So it's, yeah, the catastrophic coverage, you don't wanna have to get there, cause that means you spend a lot of money yourself to have to be there, but it is free once you do get there, so that's the good and the bad. I've had people in the past where they had some really expensive meds that there was no way around it, so we look for the way to get them to that catastrophic quickest, really. I have found too, she mentioned, GoodRx, what's the others?
single care.
Single care, there's a few of
There's a
those.
few.
And
That
Kroger
people-
has one.
Yeah,
Yeah.
Kroger has one
There's
too,
Teddy.
that's,
Discount.
that gives you some discounts. In some cases, the discount is better than what the Part D drug plan covers, so I've had some people doing that. And then,
Especially if you're in the donut hole.
That's a good
A lot
point.
of times that
Mhm.
discount, mine is Kroger discount
right,
thing, and
When
they
you,
pay better.
that's right.
and when you hit the donut hole, then other companies are willing to work with you. So if your medicine is expensive, you call the maker of it, Pfizer or whoever makes it, Johnson and Johnson, whoever. They usually have plans that can help you, but not till you hit the donut hole.
So that's a good question. That one's been up, used to be that there was the donut hole, you had 0 coverage during that period, and then it slowly, gradually went down to 25%, and it's gonna stay there, so at least there is some coverage. You have to pay a larger percentage usually than before the
And it is
donut hole.
8,000 exactly.
Okay,
So
8,000.
it's 5,030 to go in, and you hover in that little bit more expensive area until it's 8,000 out of pocket.
Yeah, so good and bad. 0 after that, but then that's an annual cycle, so, it doesn't last very long before you just have to start over. Okay, so page 6 here, we'll get back to this real quick. Some of these things we're hitting on as we go along, but they're great questions and great examples as well. So what does Medicare cost? We already touched on this already. Your total cost four kinds of payments that you might have, and these are just kind of general terms for insurance in general. You got your premium, that's what you're gonna pay every month. We've talked about a bunch of different options there already. Your deductible, that's what you're gonna have to pay first before the insurance company starts to pay after that. Co-pays, especially the Medicare Advantage plans have co-pays, your drug plans have co-pays. That's when you pay a fixed cost, $10 for medications, $20 to see a doctor, or whatever that may be. Most of the times, those don't apply, your deductible doesn't apply to that, you just pay that from day one. And then co-insurance, this generally comes into play after you've met your deductible. A lot of times that is like an 80-20, that's what Medicare Part B covers. Medicare covers 80, you're responsible for 20, and that's the co-insurance. So that's just some kind of general terms that you'll see for all types of insurances. Okay, so I've been talking a lot. You wanna talk some more, and then you wanna talk about some, when can I enroll in Medicare?
Yeah, so when can you enroll? We're in open enrollment right now, October 15th to December 2nd. Every year, one time per year, unless you have a special election period. If your LIS, which is low income subsidy, remember me mentioning that number, there's two pots of money to help people on Medicare. One comes from Medicaid, so it's usually under $1,200. If you make under $1,200 a month, say you're married and you yourself make under that, you may qualify for Medicaid. I've been in homes where the wife is on Medicaid and the husband is not. So Medicaid's, you would apply for that at DFACS or Medicaid's website. And then the other pot of money comes from Social Security, and that is under $1,800. That's the approximate number. They can help you with your medicines. And if you get LIS, low income subsidy, you can apply for that at ssa.gov, and you go under help with my medicines. And if you are one of those people who didn't have prescription coverage, then that penalty would not apply to you. That's waived. On LIS, I'm trying to think, there was another thing that just went in my head about what you wouldn't pay. Your meds are way less. Your medicines, you don't pay the typical copay that most people pay who don't get LIS. And in fact, this coming year, your meds you're gonna have a lot of meds for nothing, no cost. So it's gonna be a different year in 2024, and it remains to be seen exactly what they're trying to convey to us, but my understanding is if you get help with that, your meds will be minimal. You won't pay more than like $9 for your outrageously $500 meds. You wouldn't pay more than that for them. So it's a wonderful thing if you can get that assistance. So that's one enrollment period. Then we have a disenrollment period after open enrollment. If you should go into a plan and you're not happy with it, you have from January to March, I believe it's, hold on, I just lost my thing. It's the end of March. You can disenroll. So if you go on a plan, I always tell my people, if you're not happy with it for some reason, call me. We'll look at a different plan and move you over. So you do have an option to get out. You're not stuck for the whole year. But after that,
And that's January 1st till when?
till March 31st. Right? And then you have, there was one other,
Your initial election period too, or
initial election period, when you first turn 65, if you're going into an Advantage plan, you have 3 months before to apply for it. It will start the month of your birthday. And you have till 3 months, the month of your birthday and 3 months after. So it's a 7-month span to get into an Advantage plan, if you want that when you turn 65. With a Medicare supplement, that's the one that pays most all your bills, that you have a 6-month window. From the time you turn 65 to 6 months out. You can enroll in that with no health questions asked. And then if you're, so with the LIS, if you get assistance with your medicines, throughout the year I write people who have that. You can change plans quarterly if you want. It's really not a need to do that, but if you want to, you can. So that's an open window for those people. But if you don't get LIS and you don't have a heart condition or diabetes, because those are chronic plans that give you additional benefits to help you with those needs, and I can enroll somebody in the middle of the year who might all of a sudden be diagnosed with diabetes, and now they wanna be put on a diabetic plan that gives them more benefits, we can, that's an open window, we can go and enroll them in the middle of the year for that. But otherwise, if you have no health issues and you're all good, you're in that plan for the year. And you can't have both, you have to have that Advantage, original Medicare, or a Med Sup. Cannot have two. And if you enroll in a different plan, it'll bump you out of the old plan that you were in, so you'll only be in one.
That's right. Yeah, Medicare coordinates, especially on the Medicare Advantage or drug side, they coordinate disenrolling you from the other plan if you enroll in a new plan, so it's easy enough, you don't have to worry about calling and canceling, but.
I have another window. If there's a hurricane, and, you're in a state that has issues that had a hurricane, there's all, sometimes things come up that you're not aware of, but it gives you an open window. Say, I didn't make a plan change between October and December, and now it's March, and there's some kind of catastrophic that had happened in the area. We, as agents, know there's a catastrophic open window, and you can make it, you can say, now I want to enroll, because they will say, you might not have that option because of that.
Yeah.
So there's a
And they usually
few
last for a few
exceptions.
months,
Yes,
around that
it does
time.
last for a few months after that.
Yeah.
So go back to that thing you mentioned earlier, if somebody's on an Advantage plan and they can buy a little extra
Okay,
something to help cover hospitals.
so that is
What
like a
that?
hospital indemnity, that's my
Yeah,
word.
That's the word, yeah.
Indemnity plan, sorry, but it is considered a supplement, but it's a indemnity. Indemnity means we pay you cash, we don't care what, you use that cash for whatever you want to. So we can cater plans, to look at, if you're on an Advantage plan and you pay $295 for 7 days, we can get you an indemnity plan that will pay you $295 for 7 days. And they are very affordable. They run 40, 30 to, depending on your age, I wrote one today for 37, 30 to $50, and they never increase.
Per month?
Yep,
Per month.
so it would just protect you.
Could you buy that indemnity plan after you've been on an Advantage plan for a number of
Yes,
years,
ma'am.
and now all of a sudden I need that
Yes.
plan, you can buy it at
Yes,
any
ma'am.
time?
No health questions on those, or?
So, they're, in general, no, they're a guaranteed issue. I think it's up to age 80, and we deal with different companies, and I am actually, looking at a couple of different ones, but yes. Some of them are up to age 80, no health questions, your rate is the same, it will not increase. As long as you're paying your monthly premium, that one doesn't increase, which is a beautiful thing.
Right.
It can fill those gaps for you. And I'm sorry.
But they have real specific amounts they're gonna pay, so they know they're never gonna pay too
That's
much out.
right.
They just don't know how, often they may have to pay it, but
And
they're
those
capped
have
is what they're gonna pay, so.
a lot of, a lot of benefits, like, you can cater them to what you need, like, this one today that I wrote has an option, if you want some cancer added to that, or like money, if you get cancer, you get so much money, or, ambulance, if you have to go by ambulance, cause those are other things that you pay out of pocket for with an Advantage plan. You can put that in, whatever's important to you, there's, you can put that in according to your budget. Does that make sense?
But now, does Medicare say Part G, does it cover an ambulance?
Yes.
Yes.
It does. Even, worldwide travel too, it's some benefit
Yeah.
for,
Some more than others, it depends on the company. But close to the borders, yes, but outside, maybe not.
Lifeline, would they cover lifeline?
That's
I don't
good.
think so.
think.
Well, some are, there's a caveat, it depends on the plan, cause I've noticed a few different, just so,
Or she asked about life flight, I don't think that's
What is that?
like a helicopter life flight.
yes. Well, that's covered in Advantage plan, that I know.
Well, how
The
about,
whole thing, or the ones I've been exposed to, they want you to be a member of that, so that what they do is basically whatever they get from your insurance company, they will cover some of it, but they won't bill you for any more if you're a member. If y'all,
a member of
Yeah.
of the life flight place, like, Air Evac, there's a couple different ones. I've
We'll have to look into that out, get some more
Yeah.
detail on that.
I've had, well, you guys in, I guess Macon, does Macon area do that? In Dublin, we have one because if we need to get you to a bigger hospital fast, that's the way to do it. So they encourage people to be a member, it's like $85 a year, and basically, whatever your insurance company pays them, that's what they get. But if you're not a member, they'll get what the insurance company pays and they bill you for a lot more in a lot of
I
cases.
don't understand the member.
They have memberships, they sell memberships, it's very cheap. The Life Flight company does,
Really?
yeah.
So cause it's not here, I'm
I was
not
gonna
as
say,
familiar.
Dublin's usually flying them here, so that's
Okay.
why there's not as popular.
Yeah, that's interesting.
They go to here or Atlanta or Augusta.
Wherever the doctor sends you or wherever you're accepted, that area back out of.
Because if you want to go to Atlanta for a
Yeah.
medevac, you don't want to be in an ambulance.
Yeah, they'll
Right.
fly you anywhere.
Right.
Yeah,
I think there's
it's an expensive flight.
Anywhere that they've got it
But a med sub would
available,
cover it?
I think it would cover a portion of it, but
You don't think it cover, that's such a
it's
good
not,
question.
it's a $25,000 average
I'm gonna
flight, it's
look
not
that
We have
$100.
a apartment down in North Carolina where we are for 6 months, and an ambulance would take more than an hour to get to us,
Yes.
so
Yeah.
they have to life flight us if it was.
That's really good. I'm gonna look that up,
Yeah,
cause
that's
I've
a
never
great
come
question.
across it.
I have had the presentation done by one of those air evac companies, and that's how I know about the memberships. I get stuff in the mail all the time too. It's very expensive, but that's sort of what they sell it as. If you whatever, still bill your insurance, but we're not gonna bill you for the difference in what
Yeah.
the cost is. So,
I would expect it not to be in our supplement, but I don't know.
I think there'll be some coverage toward it,
It's a
but
really good question.
yeah, that's a good one. That's what I mean. Okay, great question. That's what I was hoping. Yes, sir.
While we're still on that, where would you find out that kind of information other than Google?
I will call the companies and ask them. I will call my med sub company and my Advantage Plan company and ask them.
Yeah, I see, the helicopters fly into the medical center all the time.
Right.
And I wouldn't expect to be, life flighted from down the road here where I live.
Can we put that out? We can do an email. We can find out about that.
Yeah, definitely.
We'll get that question.
Well, but
Yeah.
It won't leave you hanging.
Yeah.
What was the question?
If you have to be life flighted to a different hospital, would
Well,
you
I'm thinking
pay
like,
if you have a med sub
The burn center. in
or
Augusta,
an
for
Advantage
instance.
Plan?
Yeah.
And that's a really good question.
Right.
I think most of those companies set up in, outlying towns that may have some medical services, but not the major ones. If you gotta get to a level 1 trauma type place, that's what they're designed to get you there fast. Our friend Pat, Brad Skeeters,
Yes.
he had a tree fall in at home a couple weeks ago. He was cutting, and he was by himself, and he had to be life flighted to Macon, and had a broken hip and some really bad stuff, so.
I have another thing to cover just real quick. If you travel, some people stay maybe 4 to 6 months, here 6 months, and Medicare says that wherever you stay the 6 months and a day, that should be your address.
Okay.
Is it always? No. Sometimes people will do that and stay, and you can still be treated with your plan wherever you're at. But if you move and you change your address, if you have a med sub, you have to have a Florida or a Georgia or whatever state you reside in, you would have to change your plan on any of these.
How much you travel?
Well,
Say
so,
2 months here?
yeah,
say 2 months.
that's fine. As long as, if it's out of the country,
Yeah,
then there's question, and that's stipulated in the company that you have a plan with. Cause some of them say, in the outskirts, I've read just recently, in the outskirts, they may cover, but not always. And so it's not guaranteed coverage out of the country. But that would be a question and important to ask before you travel from your company.
And cruises are separate because they're medevacs and the medevacs are covered.
Well, that's a good one.
Yeah, but Part G, if I moved, I'm a Part G.
Yeah.
If I moved from here to Florida or Chicago or wherever, I don't have to get a new plan, I do.
Yes, ma'am. So you would have,
Goes with me,
Yes.
is what they said.
when you travel, it goes with you. But if you're living in another state and Medicare has you registered in Pennsylvania now and not Georgia, your plan is, they will notify you because Medicare will notify them. I think Medicare would, but yes, if you move state, I promise you, you have to get a G plan in
In
that
that
state.
state, yeah.
And their rates vary, because like Florida in some cases is more expensive in different things. And Georgia is less, other things, it's the other way around, but each state varies. So yes, if your Medicare address is somewhere else, that's where your plan has to be from.
6
And
months
that's
and a
neat.
day.
What's that?
6 months and a day.
Yeah.
That's right, that's what they
Over-
say,
over
but
half
some
the year,
people
yeah.
still push it, and, you know, as long as your address is with Medicare still here in Georgia, and you're out traveling around, that's what they know. But if you move your address, you're gonna be getting a letter in the mail saying you need to change your plans, it's expiring. Yeah.
All right, so we're getting to the home stretch here, wrapping up. Again, great questions, great content there from examples that we've had, and some things we need to find out about. I'm
Yes,
sure,
we
as
do.
well. So the how do you choose? That's obviously kind of what a lot of people is on their mind, and it depends. You know, there's a lot of moving parts as we've described here. So having somebody you can talk with and try to talk through your situation, we can look at those medications for you. We can look at the networks and how you might be using that, and try to help you make a good determination. Your health, your budget, and your preferences really are the main things that drive all of that. So
Possibly your spouse.
and possibly your spouse.
Because I'm not 65 yet, but my wife is.
Mhm.
Yeah.
So I can't,
Mhm.
there's some cost sharings and I still have to figure out because I'm fall under federal service.
Mhm.
Yes,
So I go a different route
yes.
and
Mhm.
gotta look at, is it worthwhile to bring her into my plan?
And we don't know, that's the question, is
Those are good questions.
can I get in under his plan that he still is
We got
from his
married.
retirement?
So the first thing you need to do is start with his HR person,
Mhm.
and they'll let you know.
Oh, okay.
Because that's something we as outsiders would not know. And a group plan always gives you more benefits than an individual plan. So I would never put someone on an individual plan that can have group, whatever your group, yeah, federal or state or
You may have
whatever.
open enrollment coming up. soon.
Yes, I got open enrollment and I was going through and it looks like she can fall in there during open enrollment.
Even if I'm already on that,
Yes.
we'll look into it.
Yeah, definitely look into
We'll
that.
call.
Okay.
So then, then the next question would be, do I have to keep my Part B? Because, well, yeah, you would, you do,
Yes.
you do. You have to have A
Yes.
and B to get group, so yes. Yes. You had a question, didn't you?
Oh, yeah, next number of days you can stay in a hospital on Medicare.
That,
Good question. Always, I mean, Medicare's gonna pay, but,
there's a limit to,
There's a limit.
There's a limit to how long.
say
you
that
can stay.
again?
there's a limit before you pay some out of pocket on hospitalization. It's a big limit, maybe 60 days.
I saw that somewhere.
Yeah, it's a good many. And then after a hospital stay, they
If you
pay.
have a supplement, it's different. If you have Advantage, it's different.
Right.
Yeah.
So that's to be
That's right.
remembered.
That's
With a
true, yeah, that's
supplement,
just
you
A
don't
and B.
have to worry
That's
No,
right,
you
you don't
don't.
worry about it.
Correct.
So if you do have a supplement, it will fill in the gaps.
Maximum
if you have to be
days,
on it.
Medicare itself will pay.
Yeah. That deductible for Medicare A covers so many days, and then it jumps up, but if you have a supplement.
90
it'll fill
days.
that gap. 90 days.
90 days, but that's a
That's a lot.
stint. So that's 90 days straight in a row.
Yeah. that's a
You
lot.
come out in a month, and then 2 months later, it starts over.
It starts, if you come out and stay home so long, it starts. back.
That's right.
Yes,
That's right.
yeah, so that's
Yeah.
a scenario, I mean.
One
that's-
more question, how should I sit down with y'all to look over what I have?
Um,
You did my plan 8 years ago.
It's been a little while, for sure. I'm not necessarily annually, one of the main things that changes there, if your medications have changed a good bit. That's probably one of the major drivers of talking a lot, every year. If you've got really high cost medications that you're consistently taking, that formulary can change, and all of a sudden, it was great this year, and then, wait a minute, it's now not covered.
Yeah.
So it throws, those are problems. Those have changed, your drug plans and Medicare Advantage plans have to send those out to you at the beginning of October, and that's what it's designed for, to tell you, here's what it looked like this year, here's what it's gonna look like next year, and give you at least an overview of the changes. They won't give you every detail, but.
And a really good thing for if it's prescriptions, you guys can sign into SSA.gov, open up your own social security account, which I'm sure you guys mostly have. And that way you can put your medicines in there. And as it changes accordingly, Medicare knows all the plans, like every single one. Big, little, small, whatever. And they're a really good resource. And Medicare, you can reach 24/7. So you can call them around the clock and ask them, because they know your meds would be in your website.
Yeah.
So just food for thought.
You give them your Medicare number, they'll know a lot about you real quick. That's for sure.
Chad,
Yes, ma'am.
did you say infusions are covered under Part B?
In a lot of cases, they are. That's where the infusions is Part B drugs, because you're not getting them at the pharmacy, you're getting them at a doctor's office or administered there. So that's an area, I think we talked about.
Chemotherapy.
Yeah, chemotherapy and some, rheumatoid arthritis drugs, and I've talked to people about some other things that's the best and the only way they can get it administered. It falls under Part B, which, the supplement usually takes care of that, all but the $240 a year. That's where I found out, I've talked to a couple people that have Advantage plans that are now taking an expensive drug that falls in there. It can get pretty expensive because it's usually 20% is your cost. in a lot
But
of
maximum
cases.
out of pocket, if they reach that, it covers it.
That's right.
Well,
Give you
what
that
about if
out of
you
pocket.
had an Advantage plan with the, supplement?
Oh, the indemnity?
Uh-huh.
I don't know, can you get an indemnity just for that?
No.
I don't
I
know
haven't come
either.
across one that would cover that. Mainly those cover hospital stays, ambulance costs, set costs, you know, that are on your, that are
Or
lacking in
cancer.
your Advantage, but yeah, 20 you know, I don't know of one that would cover your infusions.
What do you mean when you say cancer?
Like, so the indemnity plan, yeah, the indemnity plan she's talking about, you can buy like the gap coverage, or that's probably a better word for it than supplement, but a
Yeah,
gap coverage.
yeah.
That if
Indemnity
you were
is-
diagnosed with cancer, you could get like a set amount of money, kinda like an Aflac policy, like she said. They
you're
pay you
diagnosed with
directly.
cancer, they'll give you a flat rate.
Yeah, $1,000 because you were diagnosed with cancer, and that helps you pay your costs associated with it.
And you can choose those, like, there's plans with 10,000
Right.
on first diagnosis.
That's
So
right.
the Advantage plan doesn't pay much on if somebody's diagnosed with cancer?
Absolutely, absolutely. The indemnity plan we're talking about is cash in your pocket
Oh,
to
okay.
help you. Cause there's
Yeah.
always more cost than just, I got cancer and I have to have treatment and I'm going to the hospital. Now you're missing work, now your spouse might be missing work, or whatever. I'm traveling, I have to go back and forth.
Right.
That's cash in your pocket to do with whatever you choose.
Is that only available with Advantage?
No, no.
No, you can buy that.
Those are indemnity plans, you can get those to go with whatever.
But to address the other point of that, the chemotherapy drugs, if you have to, it's not an oral drug that you just take at home. If it's an infusion or something, you go to a cancer center. That's an example of my dad. You'd have to go down there, they'd hook him up for a few hours, he'd leave. That falls under Part B drugs. And generally, like Medicare pays 80%, leaves 20% behind. The supplement would pick up and pay the rest of that. But most of the time, the Advantage plans leave you with the 20%, up to your maximum out of pocket. So there's a cap on it, but you would probably have to pay, a lot for. So that's one of those little subtle things that you don't understand it until you have to go through.
Till it happens to
probably.
you, right?
So are you saying that the Advantage plan wouldn't pay any of the 20% for?
In most cases,
chemo?
you would have to pay 20%.
Yes,
It would cover 80, but you would have to pay 20, up to your maximum out of
regular.
pocket.
for your parking, up to your maximum out of pocket.
Yeah, still a maximum out of pocket, which Medicare alone doesn't have, so that's better, but still can be high.
Why, when I go on YouTube and all that, I type in this stuff about Medicare and all this, all the agents say they would never have an Advantage plan. They would always go with Medicare.
Medicare or a supplement?
The Medicare.
Medicare
Original
with the
Medicare.
The original Medicare.
And a supplement?
Because they're saying you don't have to get prior approval, you don't, you can go out of state, you can do this, you don't
There's a
have.
lot of freedom in a Medicare supplement.
Right.
You pay for it.
They discourage it
But you're paying for it,
100%.
and it's
Yeah.
your choice.
That's right.
What's important to you, yes.
If you have really good health and you're not expecting to have to go to the hospital or have outpatient surgeries and procedures and everything, and you've never had to have any of that, I would say the Advantage Plan most often is your best bet. But if you think you might have to have, I've had several outpatient procedures. And so I knew I had those things coming up. I knew I was looking at surgery for my knee. So I have been on the Part G and it's been great. But I pay $141 a month for that.
Right.
Last year it was $114, this year's $141.
Oh my goodness.
You know, or maybe it was yeah, that's what it
That's
was.
a huge jump.
Yeah.
It is. But yeah, that's the downside of the supplements, like the one, example I gave of my dad. 10 years into his, it's more than twice as much as it was when he started, you know.
Yeah.
So,
And a lot of it depends on companies, because
right.
I stay with the strong and the true, like, you know, the AARPs, the Mutual, you know, Omaha, and those, because they go up less.
that's right.
Some of the newbies that come out, oh, we're real cheap when you're 65.
Yeah.
By the time you're 70 and 80 and you can't make a change, they're expensive, and I'm not gonna represent them. I personally don't. You can go get them all day long, but I won't represent them.
That's right.
You can't make a change if you want to go from one company to another?
If you have health questions and you're, no, if you have health challenges now and you're diagnosed with something major, probably not.
All right, is that clear as mud now?
Right? Well, you guys gave us a lot, some food for thought too.
You did.
I appreciate that.
The good news is you get to take this home with you, and when you think about what you said about that, you can refer back to it. Certainly, if you have any specific questions, you know,
Yes.
we're gonna stick around a little bit. You can call us.
They do.
Emmy's, again, gonna be a great resource to draw from. As y'all can see, her expertise and knowledge is, thank you very much.
If I don't know something, I'll find out. Like,
Absolutely.
these were good questions, and
Yeah.
I'm grateful to hear them, so I can find them out.
They were outside the box a little
Yes.
bit, that's great. Any other questions? We got some food, so I know everybody's excited about that.
Isn't there a limit on drug expenses of $2,000, something I should kick in next year or something?
The drug expenses of,
Yeah, out of pocket drug expenses. Are going to be capped at,
So we talked about maximum, you know, are you talking about the donut hole? And
no, I'm just saying, we did pass legislation a few months ago.
so I've heard rumor of something in 2025 or 2026.
okay, they do have a cap on insulin drugs. You can only, like, most of them are $35 or less.
Yeah.
And you gotta be real careful, you gotta look really hard for specific ones. That one's weird too, they cover the brand name $35, but not the generic ones.
But I mean, the same thing, you say, it's a out of pocket.
Are you